From what you've seen today, how does that continue?
It's a success foretold, except that the dimension it has assumed is way beyond our expectation. When the state started off this project, like the manager said, Dr. Akbaveta and Dr. Ben, the chairman and the DG respectively, we were focused on health for all Deltans. If you realize that the same governor who as a senator moved the bill for Health Act, which has transformed the landscape. So all he needed to do in Delta State was to domesticate it. We believe that the way to go is universal health coverage. And unless you have that insurance scheme, which has lower cost components in terms of capitation and coverage, you will not get far with what you want to do. There are a lot of undercovered areas and uncovered areas, and we needed to make sure that we do both the urban centers and the very remote areas. Yes, we're in excess of 1.2 million today, which is significant because the target before he leaves office was 20% of the population of Delta State. This was after our tour in Rwanda, when we went to understudy the primary healthcare funded by UNICEF. But you will agree with me that we will do close to 25%, which is very significant. We found out that our local funding as a state has a lot of limitations, and then we decided to do private practice, PPP, and that PPP has worked significantly. The icebreaker is pharmacists. We created access to other private sector practitioners to play in this same space. It didn't come without challenges, enormous challenges, but they would have the storm. And today, it's a huge success story on how we can partner with the private sector to do that. Pharmacists has provided the cash backing for BOI to lend Naira to healthcare providers to deliver on the services. Capitation is low, but I can tell you it's a volume game. If you drive, as you can hear the testimony, some say they run as high as 5,000. As I speak to you, everybody on our SIP program in the state, the government is trying to migrate all of them to this program. So the informal sector is going by the day. Our maternal free antenatal care and pre-maternal care and under 5 that existed during the DOA, it has been incorporated. What this government did is to expand the scope of health provision and make it increasingly less dependent on government to provide all the facilities. I have no doubt in my mind that this program will remain a template for the federal government to intervene. And this is part of what the state, Governor Kowa's ticket in conjunction with our principal, Atiku, will bring to the table. It's a good story because you have a lot of international buy-ins. A lot of donor agencies are all over the world looking for how to improve on this. Delta has provided the platform, and it's an acid test for them. So today, the DGs all over the world speaking to people who are interested, and they're beginning to understudy the system to see how it can work, not just for Nigeria, but also for African countries. So I commend the governor. He's not celebrated on this in Delta State, but he's celebrated on this score in the world, by the world. So a prophet is not always acceptable because of issues of politics, but take it or leave it, believe it or not, this is another template, apart from job creation, apart from rural infrastructure that he has put on the table. So we're very happy and very proud that the world has come to celebrate him here, and he has created a template, not only for Nigeria, but for Africa.
Lastly, sir, speaking of Dr. Kowa, a lot has not been said about him, the positives, the transformation he did, like you said, in job creation, in education, in this. As somebody you work closely with, how would you describe the mindset of Dr. Kowa to governance?
It's developmental. It's first of all, it's a grassroots person. Once you are a grassroots person, you are connected to the very downtrodden, the very people on the lower rungs of the ladder, because you work with them, you support them, you know how they feel. So what you see about the Kowa is empathy. Even when he told you he's going to work to the last day, because he's still connecting with people who are still saying of all these things that you have done, you have not touched here, you have not touched here, and he's touching them. So that's empathy, and it's not empathy taken too far. So he is somebody who will address practical. He knows that there are health challenges. He knows that they won't be able to afford it, and these are the windows through which they can afford it. If you listen to what one of them said, one of the practitioners there said, he said the good thing, I think it's family health. He said the good thing about it is that the unfortunate thing about it is that supervision is made very easy because the roads there are good roads there. We're not saying that all the roads are good. We're not saying the roads are the best roads, but we're saying that the roads are accessible. And that's what a government is meant to do in that environment. If you take a Julius Berger and spend all those monies to do 2-3 roads instead of 50 roads, you have a problem in your hands. The next governor comes and resurfaces those roads and builds on it so that there will be a fair. There has never been equitable development. You can only have a fair development. And so you can have a fair development of the environment. So that's why you can see his position on education. 3 tertiary institutions, none on strike. Polytechnics, none on strike, right? The humongous expenditure, 5% of our consolidated revenue funds is put into this project. And then the attraction. Look at the quality of people that he has brought to bear on the project. So Okowa's story is a story of a man with huge empathy who is connected with his people and is looking for every way possible to help them. Sometimes we begin to ask, are we not going to have any limit? He says he's not going to have any limit until the last day in office, and I will support that position. It's better than just being selective.
Finally, sir, on this, oftentimes we do not understand the economic impacts. You are the chief economic advisor to the government. This case specifically and the transformation in education and job creation, how has that buoyed the economy under the management of Dr.
A healthy nation is a wealthy nation. You can have all the money and your people don't have access to health, or even we don't have access to health. Even when they have access to health, it's not affordable. And unaffordable health is an inaccessible health scheme. So you have seen a combination of quality, you have seen a combination of accessibility, and you have seen a combination of affordability. Those are 3 qualities, even in education. He also told you that in education, the biggest challenge that they had is that a lot of our people, well over 70%, never get admitted.